Headphones if you have a little bit of feedback. I don't know. All right, so I think we're at 12:30, so I want to go ahead and start welcoming everyone, our viewers on Facebook and our radio listeners. Thank you so much for taking the time and joining us on this beautiful Sunday. We have a very good topic for you today. I'm Annalisa Burgos. I'm an anchor and reporter for KITV4 Island News, and we've been doing these Tsismisan talk stories with the census, Filipino Complete Count Census Group, and basically we've had 4 so far. This is our 5th, and each week that we do this, we have different topics that handle issues that are affecting the community. Although we do focus on the Filipino community, which is a hard to count population, I really feel like these issues and topics have crossed cultural lines and apply to so many other of our minority and ethnic cultures. So I'm so glad that we get to share this information with all of you. I want to again welcome our 3 radio station listeners that are tuning in. On Oahu, we're broadcasting live from KNDI 1270. On Maui, Mix 105.5 FM, and on Kauai 107.9 FM, KTOH HD3. Thank you so much for joining us on this very important topic. Chismisan, of course, means gossip in Tagalog, which is the Filipinos' main language. But what happens is that we're taking this in a positive way and making this a time for talk story to come up with solutions for communities that are struggling right now, especially with the pandemic and the census and how important it is to be counted and get the resources we need, especially during this difficult time. I want to acknowledge our partners that we've had each time that we've had this: Filipino Complete Count Committee, of course, FYLPRO, and Ethnic Education Hawai'i. Without their support, we wouldn't be able to bring you these wonderful set of speakers each time. Also, we wanted to invite you to like the Filipino Complete Count Committee Facebook page. Lots of great information there, as well as a chance to win some prizes. So be sure to like them. And of course, we want to give a shout out to the Philippine Consulate General here in Hawaii, who have been helpful in spreading our message as well. So let me introduce our panelists. We have a great group of people that will be sharing their knowledge of this industry. Our first panelist is Representative John Mizuno. He was actually on my show this morning talking about this very important topic. He's considered a champion of the caregivers and case managers industry. He was first elected in 2006 and is currently the chair of the Health Committee in the State House of Representatives. Aloha, Representative.
Hi, thanks, Annalisa.
And of course, we have next Maria Itrata. She is the president of Preferred Home and Community-Based Services. She is also the current president of Primary Caregivers Association, so knows a lot about this industry well. Aloha.
Aloha.
Good to see you.
Thank you for having us.
And then next we have Susan Kinabo. She is the president of the Alliance of Professional Primary Care Administrators. She also operates her own 2 care homes, and I was able to interview her for a story as well about this very topic. So good to see you, Susan.
Hi to everybody.
And then Mary Baltan is our next panelist. She is the president of Adult Foster Home Care Association of Hawaii and the owner of Tan's Foster Home LLC and Tan's Transport Services LLC. Good to see you, Maribel.
Good to see you, Annalisa. Mabuhay na, aloha to all.
Mabuhay. And then, of course, last but not least, Annie Sokol is our regular guest, our special U.S. Census specialist, who is originally from Mindanao and speaks Tagalog and Visayan and constantly reminds us about the importance of participating in the census. Good to see you as usual, Annie.
Same here, Annalisa.
Okay, great. So now that we've introduced everyone, I want to go ahead and kick things off with just kind of an overview of the state of the care home industry, because we want to give our viewers a sense. Now, what I've learned is that there's actually different categories in covering this particular industry, and I want our panelists to address this. First question to Maria. Give us a sense of how big this industry is, and maybe just briefly about the different types of care homes out there.
Good afternoon, everyone. For the care home industry, we have over 2,000 care home operators and about 13,000 clients in these homes. We have regular and expanded homes, and we do have the foster care homes also, with the domiciliary homes included in this number.
Maria?
Yes.
Yes? That's
Yes.
the sense. And how is it going? I heard that a lot of the owners and the operators in the care home industry are actually Filipino. Is that true?
Yes, actually, 99% of the care home operaters are Filipinos.
99.
Yes, 99%. Wow. And, you know, it's that's the only ethnic group that really do care about our elderlies and the disabled adults and children.
And I just want to, again, clarify that when we talk about care homes, it really is these small private homes, right? People that live with the caregivers and these operators, not those big nursing homes.
Yes, these are individual homes, private homes. And, you know, it's really, at this point in time for the pandemic, this is a very, very, what do you call that one? It's better to have a care home right at this point in time because the clients are only like up to 5 and the family members. So for distancing and keeping the pandemic, you know, at its place, then I think this is a better setting for caregiving.
Interesting. Oh, well, let's give the question next to Maribel. What about the mood? What's the mood like amongst your members? Are we seeing added pressures because of the pandemic?
Yes, Annalisa, my members and I are doing the best that we can to prevent and to protect our clients and our families from getting infected by COVID-19 viruses, despite the pressure and alarming situation that we are in now with this pandemic.
How are you encouraging your members to stay positive? I know a lot of them are worried.
Yes, we're trying our best to help them as much as we could. We will do services for them soon to help them out.
Mm-hmm. And what about you, Susan? What are you seeing with your members?
In all honesty, we're all agonized due to fear of COVID-19 invading our facilities, and we are not equipped with PPE due to inadequate supply. However, being a president of my organization, I make sure that my members are well informed and updated about the COVID virus. I also make sure that we help each other in procuring PPEs at this point.
Yeah, that's part of the protection that, again, for people who don't know protective protection, right?
Yes.
Equipment to really help them be safeguarded. Okay, let's go to Representative Mizuno. You know, we talked about this morning as well as the hearing that you had last week, a forum where all of the stakeholders were present and you were advocating for some changes to the industry and their relationship to the state. What can you tell us about what government is doing to kind of help ease these concerns that we heard from our panelists here?
Thank you, Annalisa. Government is supporting the care home industry, but they need to do a better job. So first of all, one of the concerns is that we lack clarity on a single guidance plan or protocol during this pandemic for our care homes. So Maria was working with Keith Ridley from the Department of Health to try to get that standardized guideline for the care homes to follow. Again, we've been following CDC guidelines, but we really want to focus on one protocol or policy as we try to get out of this pandemic. And so we're waiting for the department to give us that structure or that policy. Second, the government is helping with some PPEs, but it is inefficient. They have not gotten an adequate supply of PPEs, personal protective equipment, to our care home operators and our caregivers. So we're working on that. We have CARES monies the federal funding to do this, and so we're going to try to get more funding from that. And finally, we need to have government support a transfer plan in case somebody has a positive COVID-19 test at one of the care homes, be it a patient or a staff member. We really need to work on a transfer plan to get that person into an isolated quarantine site. So that's where we're at right now.
Yeah, so many things that we have to consider. I wanted to talk about the deep dive more into the challenges that our people on the ground are facing. Let's start first with Susan. We talk about the transfer policy that Representative Mizuno just talked about. When someone does become positive, how are we supposed to be handling that at this point? What guidelines have you had?
At this moment, there's no clear guidelines as to what we need to do for transferring. But as per the Office of Healthcare Assurance Supervisor Keith Ridley, I am quoting his phrase from the last DOH live conference that happened July 19, and I quote, "If a client in a care home turn out to be COVID positive, the client will remain in the care home and discharge the other 4 clients to other community care facilities." Although it's not mandated yet, this idea raises a lot of concerns and fears for us as caregivers. Let me elaborate a few. Most care homes and foster homes do not have private rooms for isolating the COVID positive. However, there are some care homes who have private rooms. But the most underlying problem with this is inadequate PPEs. We are all vulnerable.
Jiggle it a little. Okay, well, that's part of the clarification that the industry is asking for at this point, right? More details on that. Let's go to Maribel. Can we get, I know shortages are an issue because as we hear some of these issues with people getting scared that the virus is coming into the communities and into their particular homes, workers don't want to go to work, right? They don't want to bring it home. Yeah. So, Maribel, tell us about what you think the policy you need to get substitutes in for caregivers.
During this time, we're getting hard time getting CNAs as our substitute caregivers. Aside from they're very expensive, we are asking DOH and DHS if we can use NA as substitute during this time. And worst comes to worst, if we can use our adult household members, 21 and older, to substitute for us, because it's really hard if we have a positive patient in our homes. I don't think our CNAs or NAs would want to come and work for us, just like what's happening now at Pearl City Nursing Home. Nobody wants to show up to work, and we do understand that they also want to protect their family members. So it's best to be prepared in case something happened to our homes.
Yeah, better to be safe in that situation. Yeah. Are you finding that people are more often calling in sick and just not showing up for shifts?
Yes, and also as caregiver, you don't also want your caregivers to go to a lot of people's houses. So you would want to secure them. So you would want to pay them the whole day to stay with you. So it's really hard because it's so expensive.
Yeah, and I don't know if there's a new standard right now. I know there was some discussion because so many people take different jobs in different places, right?
Yes.
So are you advising members not to do that so often anymore? But they need the extra shifts maybe.
Yes, and they also need the extra money. And at foster home, we're not getting paid that much. We're only getting $41.06 a day. So it's kind of hard for us. Mm-hmm. It's really hard.
Yeah, especially for a lot of people that need the work and the money for sure too. Maria, let's go to you. You know, we mentioned earlier about PPEs being one of the demands that you need for this industry. What are some of the protocols that you have in place right now, and what do you think is needed?
Well, I think because we have been asking the department to give us our priorities, the protocol priorities, because one says something else and then the other one says another thing. So we're just like we're torn between the two, officers in our state. And on top of that one, also the president of the United States, and which is something that I think we should have a protocol that is one standardized one, so people can follow instead of mixing their ideas and everything. So I did get a protocol from Dr. Arthur Yasawa from the state, and that's the one that it's 9 pages long. But I think what we need as caregivers at this point in time is the priorities, what we have to do, not the whole 9 yards, and try to read and follow and decipher what we can use. I don't think that's what we need. We need to attend to our clients first, other than reading protocols. But what I need is the standardized rules to follow, and also the list of the accessibility of where we can bring the clients if they get to be positive. Because like Susan had said, when Dr. Ridley had said to us on that day that we transfer the good ones and we keep the bad ones in our homes, I don't think that's the right way to answer us. I think they should tell us that, this is what an outline where we can bring them. So that way, then we don't have to worry not just for the clients, but also for our families that are living with us.
Mm-hmm. It sounds to me that it sounds like the common voice or request that all of you are saying is that more support, more clear direction, more commitment from the government that you are an important industry and this is a worrying situation. Representative Mizuno, after hearing some of these concerns, and obviously you've heard this a lot, as well as the requests, what can you tell us about what's being done to really show urgency with this?
Right, absolutely. Thank you, Annalisa. First of all, President Susan Puinabos was right on point when she had concern with the transfer policy. And again, I support Keith Ridley. He's a great administrator for the Department of Health. I have the highest respect for him. However, Susan was correct. If you got a positive COVID-19 patient or staff member, and you're supposed to hold that one person and then transfer the other 4, 5, or 6 patients, that doesn't make sense, because first of all, even if they've tested negative and you've got one positive patient, what's going to happen is that you need a 14-day quarantine time anyways. So those patients shouldn't be leaving. Can you hear me?
Yes.
Okay, sorry about that. So I agree with Susan. We really need to work with the Department of Health on getting a proper protocol in place where we isolate and quarantine that positive COVID-19 patient and or staff. So that's number one. The second part, what Mary Beltan had brought up, was an excellent point. During a pandemic, we're losing a lot of frontline healthcare workers. And it is true, once they find out that a patient or a staffer is COVID-19 positive, they don't want to go to the workplace. Because of that, we're asking the Department of Health to allow us the flexibility to hire a nursing assistant instead of a CNA for a substitute, a certified nursing assistant for a substitute, or if there is a dire need, a family member age 20 and up. They haven't gotten back to us yet, but we're hopeful that they will approve that. And finally, you heard Maria Estrada say that we need a simple protocol, a guideline for everyone to follow. I agree. It's kind of buckshot. Again, I recommend following CDC guidelines to the caregivers. But it would be a lot better if the Department of Health just came down and gave, not a, but maybe a one-page protocol or policy to follow as we're going to navigate through this pandemic.
I know, and it helps to have people at the government be champions, of course, because you really need to have a representative be able to talk. So I'm sure that they're thankful that you've been able to do this. Testing, I know has been an issue for you as well. Tell us about what the challenge is to get more widespread testing for these caregivers. I mean, they're on the front lines like all other healthcare workers, and with community spread, why is it so hard to get testing for them?
It's just been difficult for the caregivers to get testing, COVID-19 testing for their patients and their staff. The reason being, they're 24/7 care. So if you've got patients, your focus is on them, making sure they get to their doctor's appointments, making sure you go to Costco and resupply the food that's needed for all of them. Very difficult for a care home operator to just, up and leave and get it for everyone. I've recommended mobile testing. And so if any caregivers need testing, they should not be able to pay anything co-payment, because the health plans, Kaiser, HMSA, they've indicated you do not have to pay for co-pay. If the patient is a Medicaid client, Medicaid should cover for that COVID-19 test. But yes, my recommendation to the caregivers would be give my office a call. We'll do our best to get a COVID-19 testing unit to your house.
I know that's been one of the concerns. Let me just ask all of you guys, the frontline workers there, have you been tested? Do you feel like your members want this? What's your sense of the ground? Let's start with Maribel.
Yes, I did. I have to get tested, but because it's not medical necessity, then I had to pay for my co-payment.
So they do ask for co-payment?
Yes.
Okay, and Representative Mizuno, that's correct, that they do collect co-payment? I just want to clarify.
No, Maribel, if you call me personally, I'll make sure you retest it and you won't have to pay co-payment.
Okay, so there is some confusion there, right? And I think that's why some people don't want to get tested, because you have to pay. Do you mind sharing how much was it expensive?
It was kind of expensive on mine. It's about 100 something.
Oh, that's expensive. Yeah,
120.
I did have my COVID test also, because I was worrying when I was sniffling. So I went to see my doctor, and he says, "No, you gotta get tested." So I went to Palimomi, and thank God, I count all my blessings. I come up negative. But I think, part of it is paid by my medical. But it's like Maribel said, I think it's over 154 or something like that.
So you had to pay as well.
Yeah.
Representative Mizuno, look, all of them paid.
Yeah.
Can I get a refund?
Yeah, well, I would. So, groups that I know that offer free testing as long as you have your insurance, no copay, would be Dr. Kovich, Premier Healthcare. He does free testing, but call to make sure. And of course, Representative Capo's urgent care unit. She has 2 urgent cares law who should not charge anyone copays. So I can confirm that, because that's it, and I have to pay a copay for my test.
Yeah, and you as well, Susan. You mentioned that you had to pay for yours as well.
Yes,
I just heard
I have to pay 125.
So,
yours is cheaper.
It depends on your insurance, it sounds like, from what everyone was saying, whatever they charge.
In actuality, before you take the test, they will ask you questions. And one of the questions are you feeling sick? Do you have fever? And of course, if you say no, on all those questionnaires, they will not cover, actually. They will not cover. That's the time you're going to pay.
Oh, can I interject? Can I interject?
Yes.
So that came up with Representative Cabanilla as we did our mobile testing units in Caliche, other places. And some of the patients were coming in saying, I don't have symptoms, but I'm here. Can I get tested? And that's based on caregiver, the provider. So Representative Blinken said, peace of mind, you're in, you don't have symptoms, I'm going to test you. And my understanding is Scott Miskovich, Dr. Miskovich, will also do the same if elderly or you can at home. So, two things. Worry about being symptomatic. We will get you that test. Second, contact either Premier Health or Rep. Manila's group to confirm that they're not going to co-pays. But I know for me, they don't charge copay for any tests for COVID-19.
Okay, well, this is good information for our ongoing workers, right? Because it is a snapshot in time. So just because you guys took it that one time doesn't mean you're in the clear, right? So next time that you guys want to take it, you call Representative Mizuno and then get him to give you the test free next time. And actually for the members, right? Because I know that we talk about these free events all the time. Like, we promote them on the show, on the newscasts all the time. But I don't know if people are taking advantage. I know sometimes there's lines, the drive-through clinics. There's a lot of people that go. Do you think people, Susan, do you think people would take advantage of that? Your caregivers, your members?
I believe so.
Okay.
I believe so.
Okay. And
that would help.
What about you, Maria? Do you think people also would take advantage of if
I
they
would
had
think
more of those?
so. Yes.
There's no stigma. I feel like sometimes there's a stigma of going.
I know they're scared because they don't want to be found out that they have the positive testing, but I think it's for the good of themselves and also their clients that they take care of. Because if you find out that you are positive, then you take all those extra precautions, you quarantine yourself at home, don't go anywhere. So I think it would help. But I know that they're scared to be found COVID positive.
Yeah, because then you're
a lot of them. Yeah.
Then for 14 days you don't have work, right? You are out of job, you don't have any more money. So I know, like, for example, at the Hawai'i State Hospital, they have issues now with people that are symptomatic even, but they don't want to go for testing because they have to use their own sick leave, or there's these issues like that. So I don't know. But this is an interesting topic, I think, for our viewers that are curious about what they can do. Do you feel that we can do something about the stigma? Maybe Maribel, do you think there's something we can do about fighting the stigma around testing and talking openly about COVID?
Yes, so we do. We were telling them to better to know, and so we can prevent the spread of the virus, rather than you don't want to go and then come to find out you already spread it with your family and of course to your clients. So it's better. I was just telling them to go and have tested if possible.
Do you think the families feel better if you talk about? How do you talk about it with the families of your patients there? Do you explain to them what kinds of things you're doing to protect them?
Yes, we do, and we do FaceTime or video messenger to them. We try to ask them not to come and visit our clients right now, to help them out too and to protect them, as well as our families.
And what about you, Susan? What about how have you been spreading the message to the families that are affected?
At this moment, both of my care homes are in lockdown. I don't accept visitors. Although I try to encourage my family members to FaceTime every so often, whenever they can, in order to talk to the family members who are staying in my care home at the moment. We don't accept visitors right now. Sorry, but I'm very careful with this because we don't have enough PPEs, as I told you. We don't have any more things that can be done, guidelines. We don't have adequate guidelines as to what needs to be done. So the first thing we can prevent from spreading into the care home is not to accept visitors at the moment.
Mm-hmm. And what about you, Maria? Lastly, for you, how are you communicating to your patients and their families?
At this point in time, I do have a daycare center, and as it is right now, I closed the daycare center until further notice because of the distancing. So it's very, very hard for me to, open the daycare because of the COVID. We don't know who is positive or negative, because I do have about almost like 66 to 70 people that comes into the center every day. So right now they're all on furlough, and my employees are just coming in and out. I follow them, some of them also, because the more people that you have, the spread of the COVID is greater. So it's very hard. And I talked to some of the care providers, the care home operators, like you said, they have this stigma that if they're gonna go for testing like that, people might say something to them like, oh yeah, she's COVID. But it's the perception of this pandemic. It's making people, they freak out. Some of them, they don't even go out anymore. So this is something that turns everybody off socializing, and which is not, permitted at this point in time. So there's a lot of things that, we need to make the people aware of this disease, that it's not easy. This pandemic is not a joke.
Yeah.
Like some people, they don't want to wear masks, but I don't know what they are thinking. So they probably would believe it when they get it. But why wait till you get it? Do something to prevent it. So,
well, and that's why it's good that we're talking about it openly, and you guys can continue to spread the word about what you're doing on your end as well. Okay, so I'm going to give you all a break because it's time to bring Annie into the conversation, talk about the census. So Representative Mizuno, Susan, Maria, and Maribel, you can take a little bit of a break, and we're going to talk to Annie now about the census and how it affects us now, especially so important with the resources in healthcare that we need, right? So first of all, give us an update, because we check in every time about how we're doing with our numbers. Give us an update, yeah.
Yes, thank you, Annalisa. Aloha, everyone. The census is still going on. The state of Hawaii stands at top 34 across the United States, and 58.4% of the households responded to the census already here in the state of Hawaii. And we still have so much work to do. And another important update as well is that we're about to start the non-response follow-up sooner than originally planned. We planned it at mid-August, but it will start on July 30. The non-response follow-up is when our census takers knock on doors to follow up with the households who have not yet responded to the census. So we're going to start that beginning July 30, and you will start seeing more census takers in your neighborhood. So please help us and do your own census at your own leisure via online, over the phone, and you can also send back your paper questionnaires.
Yeah, and especially now you're wearing your masks, you're doing the social distancing, even though you're going in person.
Definitely.
Right? Need to protect.
Yes.
I'm sure, that's a concern now as well. But give us a kind of a sense of what the impact is of the census on care homes specifically.
So I was a case manager before I started with the census, and I had the pleasure of working with caregivers who are amazing and who care so much about their clients, and they really are a family to them. Some of them live, the clients live with them for decades almost. So it's like family, right? And many of these individuals really rely on Medicaid and Medicare supplemental medical insurance to ensure that they get the proper care and services that they need. And now the census guides how federal funds such as Medicaid is distributed to states. And it's one of the biggest allotment of federal funds that comes into our state to ensure that our elderly, or people with disabilities, or anyone who needs these services receive the care our care home providers provide to ensure that they're healthy, comfortable, and thriving. And so getting that funds that we need in our state really impacts the care home industries.
Yeah, and so many, especially 99%, as we heard, are run by Filipino small business owners. So important for that. Well, tell us about how care homes and caregivers can help in promoting the census.
So it's really important for our caregivers to make sure that you count everyone in your household, especially the people under your care. So please remind your family as well, your friends, and your fellow caregivers to respond to the census and work with the census enumerators who contacted you. You can also call me if you need any help with responding. We will also be working with the panelists that we have here, your leaders in our care home industries in the future, so we can better assist you if you have any questions with your census questionnaires.
Yeah, and definitely we have to get to know the importance of participating in the census, of course. It's not that hard. I did mine a while back. And let's bring back our speakers. We'll ask them. We'll put them to the test, right, Annie? If they,
we want to know.
Especially, like you said, these are essentially households, right? These are homes. Right. They're like families. So, exactly. And I think we talked about this before, is like if you get multiple envelopes, like how does that work? Does the census send one to each of those residents, or do they just send it to that one care home operator?
Just one per household. So one responds, but you make sure that you count everyone in your household.
And I know there was a touchy subject before where I know this isn't the case with our licensed businesses here today, but there are situations where, you know, there's some illegal, unlicensed care homes, and they're squishing in multiple people in their homes. And I'm not condoning that at all, but I know we talk about let's have an honest count of that as well. Right, Annie?
Of course, it's not, obviously it's not the ideal situation at all, but please count everyone who lives in your households. We are just doing a head count. Your responses are safe and confidential. It is not our job to report that to any government agencies at all. Obviously, you can also ask our panelists here to, you know, help you get your license, right? Which is the best part. But yes, with the census, please make sure that you count everyone, even though you probably feel like you should not, you know, you're not licensed and you feel like you should not count the people who are doing your household who are living in your household. So you are doing a disservice to them if you don't count them, because we do need that funds that, you know, we can utilize for healthcare to come to our state.
Yeah, it's important. I know there's a lot of stigma out there. There's people that want to hide certain things, but let's do this for the good of the community. No one's going to take you to jail or deport you. You promised me, right, Annie?
No.
Okay.
Yes, we are under oath to protect your information.
Good. All right. Well, let's go around the circle. Let's start. I'm just looking at my screen. So let's start with Maribel. Did you do the census? How was your experience?
Yes, I did. Good. I did it online. And it's really fast and easy, so I never have a problem with it.
Okay, good. And what about you, Maria?
Well, I did my census, I think it was just a couple of weeks ago. It's very simple. The only thing is that my question to Anne is, you know, in some of the care homes, the ones that have private clients, are the clients counted with the census?
Yes, as long as with you. Yes, Miss Maria, as long as they live there and sleep most of the time, they should be counted in your household.
Okay, what's going to happen to those people that that are hiding their clients in the care homes? That's when I'm always puzzled with it, because, you know, even if they say that, oh, I only get 5 clients to the max. But I know that there are some that had clients that are private pay, so they don't show up in those census. Representative, what can we do with those kind of people that are hoarding those, hiding those clients in the homes?
Call me up and I'll report it to Keith Ridley. We've closed down in the last 3 months about 4 illegal care homes, unlicensed care homes. And what I do is I usually repost the press release from the Department of Health. So just contact me and I'll get the information to Keith Ridley, and the Department of Health, along with the Attorney General's office, will investigate. Once they find out that there are private clients that aren't being claimed, therefore they're illegal, they'll close them down and they'll fine them.
So what happens if the care home is licensed and they have their maximum, but they're still with private pay, they're still hiding them somewhere?
One of two things. Either going to take the illegal clients to a licensed care facility, and then with the current care home that had extra people, they're going to probably send them. They may give them probation for 6 months or even a year, but they'll allow them probably to run their businesses if they don't do more infractions, anything illegal. But the extra patients need to go to a licensed facility. It can't be housed there because they're already over their max.
Correct. Okay. So the census is very good to me. I think it would generate, especially in your areas, it will generate some funding for schools, recreation centers, all those other good things that comes from the government due to census. Because I think I did work with, I think it was either Bennett or somebody else before. And, you know, the good thing about doing census every 10 years, it would give us an opportunity to, especially political divides, you know, the resection areas, so that it will be evenly distributed to that particular area, especially in Waipahu. And I'm hoping that the redistricting and all that will be changed in Waipahu, because we do need a good what do you call that one?
More resources?
The areas, yeah. The areas are too overpopulated and some are not. And with the Filipinos right now being the most ethnic people, in Waipahu and Kalihi are the ones that we need to redistrict those places at this point in time. So I think the census will tell us, probably will direct us to sectionize all those areas.
That's why it's important to have accurate counts, right? So just Susan, quickly, your experience.
I didn't have hard time filling up the census through the email. But there was one individual from the census that came and checked one of my facility if there are really 5 people living, 5 clients living in my care home. So that was not a problem. So it was okay to me.
Okay. And then finally, Representative Mizuno, just thoughts, words about how important the census is for this industry.
Very important. It can affect extreme amounts of federal funding for the state. So we should complete the census always.
Very good. All right. Well, thank you, Annie. I appreciate you. Just final thoughts on why we should care again, as if we didn't know, but just in case.
Yes, as someone who worked with people with disabilities before, I saw firsthand how these federal programs impact individuals and their families. And it takes a village to make sure that they can be independent and thrive as individuals. And by responding to the census, you ensure that our community get our fair share of federal funding, and you can make a huge difference by just making sure that you and your ohana is counted. So responding is caring. Thank you so much.
Thank you, Annie. All right. So let's get back into our discussion about the industry. Let's focus on the economic viability. As we know, all the businesses, small businesses in Hawaii and across the country are suffering because of the pandemic. Maybe we'll talk specifically about how it's affecting your businesses. I know we touched on it a little bit. Maria, with you, how is it going? How are you surviving through this? Do you know if there's any access to funding or loans or grants or things for you?
How I'm standing with my business right now is, the government had given the banks to give us loans, and that's what I'm living for right now. I'm using that to pay for the employees, especially now that to keep them in my payroll, because they need their medical and they need to put food in their on their table. Even though I don't get no reimbursement for the services that we are doing, we make it. I just want to make sure that my employees and my caregivers have monies for their families. So that's why I'm staying. I'm operating. I'm open partially.
Yeah,
I know that it's a great sacrifice for the company, but money you can find, but people's lives you cannot. Once they're gone, they're gone. So this is what my mother had told me before. Whatever help you can give to your neighbor or whoever needs the help, do it. So that's why I'm relying on God's help and the community and the government to, help us out on financing.
So important to just keep going. Maribel, what about you? Tell us about your situation.
With the foster home, we're trying our best to protect our clients as much as we can, so that we will not have any hard time getting patient. Because when you lose client, a lot of my caregivers doesn't want to get any client at this time, especially from the nursing home or the hospital, because they don't want to have to affect their other clients or their family members. So we're trying our best to protect them so that they will not get COVID viruses, and we will have them in our home.
Are the members taking advantage of loans or funding, anything like that?
Oh, we have the provider cares app, but it's only about 2% of our revenue. So it's because it's based on our Medicaid patients. So if you have Medicaid patients, it's about only 30,000 a year. So if that's only 2% of your revenue, so that would be only $600. So it's not even enough for our PPEs and our disinfectant, especially now. Yep. Everything is pricing, so it's really hard for us.
That's true. And what about you, Susan? Tell us about your situation.
Well, my facilities, we were able to qualify for the PPP loan to carry over the payroll for my employees, which is very good. Secondly, we have to protect our clients, as Maribel said, from this COVID-19 virus, and we use CDC guidelines to cover ourselves with this, because right now we don't have guidelines from the department. We don't have proper guidelines as we speak. Some of my the problem that I'm facing right now is some of my workers don't come to work because of the fear of the virus. So I don't know how they're getting their daily living at the moment. I'm not too sure. But so far we're okay right now.
And Representative Mizuno, are there kind of resources at this point for, we've heard about PPP, bank loans, any kind of way to just stay afloat, like so many other small businesses out there. Is there any advice or any other resources you can mention for our caregivers?
Yes, for the Medicaid care homes, they've gotten some PPEs, but it hasn't been an adequate amount. And for the other care homes, the Department of Health has indicated that they've identified a source of PPEs. They're trying to determine how much, what the rational amount would be per care home. They're not done yet with that, but we're hoping that we can get the PPEs to our caregivers as soon as possible. Second, there was an issue that was brought up by the caregivers. They had asked for hazard pay amid the pandemic. I brought that up to the Department of Health as well as the legislature, and I was informed that you cannot get hazard pay because it's something that needs to be placed in the state budget. So we're going to have to do that next year, not this year. So unfortunately, for the caregivers, I'd love to get you guys hazard pay, but it's not going to happen this time. And also, I've sent out a link with grants from the federal government. And so I'll probably send that out to the 3 presidents today, and they can send it out to their clients, their members. So hopefully they can qualify for these grants. They're not big, a little bit helps at time.
Yeah, I mean, at this point, you just have to apply for everything, and just see what happens. And there's so much CARES Act money. I'm just curious, like, why at this point is it being allotted to this industry? You mentioned a little bit for PPE. I mean, the whole point of this funding is supposed to be for testing and coronavirus-related, emergencies. And this is so important for us with our high, our age, our older people here are just, there's so many of us here. So how can you actually encourage that CARES Act money goes to this industry? Is there a way?
Yes. So today's forum is excellent because government always watches what we're doing. Last week's forum at the legislature was also important because it impressed upon the lawmakers to work with the administration to make sure the millions of dollars in federal funding through the CARES Act monies actually go to PPEs and go to our caregivers. They've kind of been left out of the picture. The big hospitals have not. And I'm not picking sides. I'm just saying that it seems like a lot of the money has been allotted, but mostly to big hospitals and the big nursing homes. And unfortunately, being a champion for the community homes, it seems like they've been left out. If anything, they've gotten the short end of the stick. So we're going to continue to fight vigilantly to try to get more PPEs and more funding for our community caregivers because they're the heart and soul of our state. They really care for our Puna and disabled.
Yeah, and that's the big thing. It's kind of the invisible heroes, like we don't talk about it as openly, but they're there as doctors and nurses and all of the other frontline workers, but it's so important for us here. So I just wanted to kind of wrap this up with your insights, your thoughts as we move forward. We're talking obviously about recovery and how we can get beyond the pandemic. I just wanted to see what you guys think you need and what kind of support going forward aside from what we've mentioned already. What do you think the future is for this industry? So let's kick that off with Maribel.
With the foster home industry, we ask our government to support us more, give us more in services, more PPEs, and monetary support, especially when we have positive COVID patient in our homes. As Kit Ridley said, to transfer the negative patient instead of the positive patient, which is nakakaloka in Tagalog, which is crazy. If this is the case, it will be really, really hard for us caregivers. Since we're dependent on our income for our foster homes to pay for our mortgages, rent, and our other obligations. So please help us. We are trying our best. We're trying to support the government. We're saving them a lot. So I hope that they will help us.
All right, very good point. And Susan, what about you?
I completely agree with Mrs. Tan. My wish list actually is the state to provide us an alternative facility for positive COVID clients. Secondly, I'd like to have adequate supplies of PPE for the community caregivers. And the need of care home and foster homes will remain exorbitant in the state of Hawaii. We have enormous elderly population. They need us to care for them. The state don't have enough nursing home, and they are costly too. We provide half of the price or the cost for the same care in a smaller dwelling facility. We need that. They need us, but please support the care home industry.
Yeah, it's so important, like you said, half the cost, and that's why so many people put their loved ones in these, because they're they can't afford these. I was talking to AARP, and some of these nursing homes cost upwards of 150,000, 200,000 a year. Wow. Like
yes,
that is
true.
expensive, and the average working Hawaii resident can't afford that if they're putting their family member in one of those. So what about you, Maria?
Well, as I've been campaigning from way back, how many, 30, 40 years ago, that the reimbursement that they're giving to the care providers is never enough for caring for the clients that they have for 24/7, 365 days a year. For the reimbursement that the federal and state are giving us can hardly pay for nothing, actually. Because if you go work to McDonald's and you get paid for $12 an hour, and if we do that to our caregivers, to the care homes and foster homes, it's not enough. So I'm asking the state and federal, because there's a lot of savings that we've been doing as caregivers, but they never listen. They give us a raise $50 for how many years? 10 years later. But I think right now at this point in time, because of this COVID, there's a lot of expenses I had incurred with how to take care of the clients now. It's more, it's not like before that, we can just take them to picnics and all that. At this point in time, it's very hard to keep them at home, especially those who have behaviors. It's not easy to be a care home or a caregiver, because the things that you do for them, your monies that are given to reimburse us for all this is just enough to pay for the food that we, for our families and for the clients. But the thing that you go through every day with them, you can never ever pay that. Mm-hmm. They become a part of your family. That's why we, a lot of these young operators right now, like I said before, that I became a care home operator because I wanted to kill two birds with one stone. I take care of the children when they come home from school, and also the clients. What I'm trying to say right now at this point in time is we need more training for the younger ones so we can keep up with this industry. So I'm willing to put my 2 cents in whenever a caregiver, needs help. But if the government keeps paying us the same payment all these years, for 44 years now that I've been a caregiver, they never did come, not even close to half.
Wow, yeah.
They're paying so much, yeah, but
if
not
anything,
to the care home operators, yes.
Yeah, Maria, good point. If anything, this pandemic raises kind of awareness of this industry even more, and how vital it is, especially with our aging population here in Hawaii, and how valuable the service is that you all provide. So I just want to say thank you to all of you and all the work that you do for taking care of our kupuna here. You know, it's so hard. And, you know, my parents are aging too. So, I mean, that's just the way it is. We have to take care of them. Last word, Representative Mizuno, because we are out of time, but I wanted to give you just kind of words of wisdom or some advice as we look forward to lift this industry.
Real quickly, we need to work with the Department of Health on a quarantine site, isolation site, transfer of positive COVID patients or staff. Second, we need to see if we can get NAs or family members to be a substitute for caregivers. Third, we need to find out if Department of Health and Human Services can provide more adequate supplies of PPE and get access of PPEs to our caregivers. And fourth, finally, we need standardized guidelines for all of our care homes to follow. Thank you for having us.
Appreciate it. And I'm going to add more pay.
Yes.
I'm just going up
next year, more pay.
More pay. We need to work on that. You know,
more pay.
I feel the pain there. You know, and especially with the economic downturn that we are going to be facing for many years. So again, that is all the time we have. Thank you so much, everyone, for joining us today. Representative John Mizuno, Susan Kinabo, Maria Itrata, and Maribel Tan for joining us. Appreciate your time today. Salamat, maraming salamat, of course.
Thank you.
Let's bring back, not yet, don't go away yet, don't go away. I need Annie Sokol. I still have housekeeping, guys. U.S. Census Specialist, Annie Sokol. We can bring her in. There she is. Thank you, Annie. Again, everyone, Filipino Complete Count Committee is the Facebook page for all of you, this information, and of course prizes. We love that. And today's Tsismisan Talk Story again was simulcast on Oahu on KNDI 1270, on Maui Mix 105.5 FM, and on Kauai 107.9 FM KTOH HD3. Thank you so much to our radio listeners for tuning in. All of this will be on Facebook, Facebook as well as YouTube, as well as all of the social media, so you guys can rewatch it, share it with your members, share it with all your community. Again, mahalo to our partners, Filipino Complete Count Committee, FYLPRO, thank you so much, Ethnic Education Hawaii, and all the people behind the scenes, Sergio Alcubilla and Char McGinnis of FYLPRO, and of course, our lovely leader, Madam Senator recently, Banet Misalucha of the Filipino Complete Count Committee. Thank you so much for producing this series. So important, such an important information for everyone. So, and I'm Annalisa Burgos. Aloha, everyone. Maraming salamat ulit.
Thank you, Have a good weekend, everyone.
Have a great Sunday, everybody.
Bye.
Yeah, stay safe, everyone.